Hey everyone, and welcome. So glad you're here. Today, we're bringing you a highly requested explainer that's designed specifically for you, pharmacy students and dedicated healthcare professionals. We are diving straight into a concise revision blueprint for mastering good pharmacy practice, or GPP. Look, by the time we wrap up this explainer, you'll have the exact high-yield knowledge you need to absolutely ace your licensing exams. But, even more importantly, you'll have the principles that actually empower you to save lives in your day-to-day practice. Let's dive right in. Okay, picture this for a second. A patient walks in, hands over a prescription, and the pharmacist dispenses the absolutely perfect correct medicine. Simple, right? Yet, a week later, that same patient suffers severe harm. Why? Well, because they weren't properly counseled on exactly how to take it. It's the right drug, but totally the wrong execution. In fact, medication non-adherence or improper use is literally a leading cause of hospital readmissions all over the world. This life-or-death stake is exactly why good pharmacy practice exists in the first place. Without proper counseling, the benefit of the correct medication completely unravels. It just goes to show you that dispensing is really just one tiny fraction of the whole shebang. So here's our quick roadmap for today. We're going to cover the foundation of GPP, why GPP matters, the 4 core objectives, real-world applications, and we'll wrap it all up with a licensing exam cheat sheet. Moving right along to Section 1, the foundation of GPP beyond the counter. All right, so here is the formal textbook definition that you really need to lock into your brain for those exams. Good pharmacy practice is the standard of professional pharmacy services that ensures patients receive safe, effective, and quality pharmaceutical care. I really want you to hyper-focus on those 3 magic words: safe, effective, and quality. You see, your responsibility as a healthcare professional actually begins, not ends, when you hand that medicine over to the patient. You are the ultimate safeguard. Now, if we want to distill that formal definition down to a super simple core memory hook, it's this: doing the right thing for the patient at the right time and in the right way. Just keep that mantra repeating in your head. The ultimate goal of literally every single action you take in the pharmacy is improving patient health outcomes and promoting the rational use of medicines. Honestly, if you're ever in doubt on the job, just stop and ask yourself, am I fulfilling this quote? On to Section 2, why GPP matters, life or death responsibilities. The contrast here is just stark. Without this GPP framework, patients are facing some terrifying health consequences. We're talking medication errors, completely unchecked drug interactions, incorrect dosing, and rampant drug misuse. It's basically a total recipe for inappropriate treatment and harm. But with GPP in place, you guarantee patient safety, medication effectiveness, vastly better outcomes, and you build this absolutely vital public trust. GPP is the bridge that takes someone from being just a basic dispenser to a highly trusted medication expert. All right, Section 3, the 4 core objectives, which is really the structural heart of GPP. Now, if you're taking notes for your exams, perk up, pay very close attention to this part. These right here are the 4 foundational pillars of modern pharmacy practice. Number 1, promote health. 2, supply quality medicines. 3, ensure rational use of medicines. And 4, provide pharmaceutical care. Essentially, everything you do is going to fall under one of these 4 umbrellas. So let's break them down real quick. Objective 1 is promoting health. This means you're stepping up to act not just as a medicine expert, but actively as a health educator. You should be diving into things like smoking cessation counseling, spreading vaccination awareness, running disease prevention programs, and heavily prioritizing patient education. You are right there on the front lines of public health, stopping disease before it even has a chance to start. Then we have Objective 2, supplying quality medicines. Guys, this one is non-negotiable. You are entirely responsible for ensuring that your stock is safe, effective, and properly stored. You absolutely must adhere strictly to all legal and ethical requirements. And I really want to drive home this ironclad rule. Expired, damaged, or improperly stored medicines must never, under any circumstances whatsoever, reach a patient. Quality control, it's entirely in your hands. Moving to Objective 3, ensuring rational use. If you want a quick trick to memorize this for your exams, just remember the power of the word correct. Your job is to make sure the patient gets the correct medicine, at the correct dose, for the correct duration, through the correct route of administration. Correct, 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 correct. It's a vital 4-part checklist to catch and prevent medication-related problems before the patient even walks out the door. And finally, Objective 4, provide pharmaceutical care. This just means that modern pharmacy places the patient at the absolute center of every single service. You aren't just, handing over pills. You are actively monitoring their therapy, assessing their treatment outcomes, constantly keeping an eye out for potential adverse effects, and collaborating hand in hand with other healthcare professionals like physicians and nurses. It is a massive team effort, and the patient is right in the middle of it all.
Let's move to Section 4, Real-World Application, Bridging Theory and Daily Practice.
Okay, let's take all that theory and put it into practice. Careful dispensing isn't just about handing over a little cardboard box. It literally means catching an unusually high dose prescribed by a doctor and actually picking up the phone to verify it. Counseling? That means taking the time, real time, to educate a diabetic patient on exactly how to administer their insulin. Patient care means catching a serious drug interaction before it happens. And quality assurance is as practical and hands-on as ensuring your medicines are stored at the exact correct temperature. These aren't just concepts, these are your literal daily applications of GPP.
Now, I also want to quickly touch upon the kind of hidden, behind-the-scenes work of GPP. You have to fiercely maintain patient confidentiality, protecting their info and sharing it only when professionally necessary. You also must engage in CPD, or continuous professional development. Why? Because healthcare is constantly evolving and you've got to stay updated with the latest clinical evidence. And lastly, meticulous documentation and record keeping. It's not the most glamorous part of the job, for sure, but it is absolutely required for legal compliance, accountability, and making sure there's continuity of care.
And here we are, Section 5, the licensing exam cheat sheet with your high-yield GPP facts. Get your pens ready because here are your high-yield exam essentials. 1. GPP focuses completely on patient-centered care. 2. The primary goal is always improving patient outcomes. 3. Patient counseling is an absolutely essential component. 4. The safe and rational use of medicines is a core principle. And 5. Quality assurance and professional ethics are fundamental requirements. Seriously, master these exact concepts and you can confidently tackle any GPP question they throw at you on exam day. So as we wrap up this explainer, I want to leave you with a final provocative thought. Ask yourself, are you just a medicine dispenser or are you a healthcare professional who saves lives? Mastering good pharmacy practice is the exact thing that elevates this entire profession from just a transactional job to one of the most respected, trusted healthcare roles in the entire world. It's a lifelong commitment to safety, to ethics, and to quality. I really hope this explainer has given you the clarity and the structure you need to crush your studies and excel in your future practice. Keep learning, keep focusing on your patients, and we'll catch you in the next explainer.